from CBS 17 News.
Good afternoon, I'm Steve Sprague, CBS 17. We're going to briefly interrupt the talk because right now Governor Roy Cooper providing an update on COVID-19. Let's listen in.
New cases since yesterday, 3,305 people in the hospital, and sadly, 8,915 people who have died. Our prayers go out to those who've lost loved ones or who are battling this virus. Today, we're encouraged to see that our COVID numbers have stabilized in recent days, and that's good. But the reality is that they are still high, and that too many people are still falling seriously ill and dying. The virus is still raging through our communities. With more than 3,300 people in the hospital and the percent of positive tests in the double digits, we know this virus is still spreading. And with at least one more contagious variant of COVID-19 in our state, we still have work to do. We cannot let our guard down, especially in these cold winter months. That means we need to keep wearing our mask and practicing social distancing when we leave our house. Now, you've heard me say this a lot, but it's because these simple measures have and will save lives. Even as we continue our prevention efforts, the top priority in our state is getting vaccines to people as quickly and as equitably as possible. As of today, North Carolina has administered 99.8% of all the first doses that we have received from the federal government. I'm grateful to the Department of Health and Human Services, Emergency Management, and health providers across the state for working hard to get these shots out there. The sticking point right now for our state and the nation is not enough vaccine. We do have thousands of shots, but there are millions of people who need 2 of them. Yesterday, we got some good news when we learned that the federal government will increase vaccine shipments to the states by 16% over the next 3 weeks. That will help, but we still need much more. I know this is maddening and frustrating for many of you. Hundreds of thousands of you have had success in getting vaccinated, but many more of you haven't been able to get appointments or have been put on waiting lists. Trying to get someone on the phone and long wait times, I know that's frustrating, but it will get better as the state gets more vaccine and more providers giving it out. And until we do, we all need to keep up with these 3 W's. Plan and wait for our turn, as hard as that is. I want every single North Carolinian to be immunized to prevent this cruel disease. North Carolina will make sure everyone has a spot to get their shot. This pandemic has strained our patients, but also our economy, and many people are struggling financially. We set up the HOPE program to relieve some of that strain by assisting with rent and utility payments. As of this week, the HOPE program has paid nearly $130 million to landlords and utilities on behalf of more than 34,000 low-income North Carolinians who faced eviction or utility shutoff. With the General Assembly back in session, I hope to work with these state legislators to appropriate recently passed federal funds to keep helping people and small businesses that are hurting. There is significant need out there, and we hope to provide additional funds to expand the HOPE program. At this time, I'm going to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to give us an update on our COVID data. Dr. Cohen.
Thank you, Governor. It's been a while since we've had a day-to-day, so let's dive in. As a reminder, we look at a combination of trend metrics.